Good evening, everybody. Welcome to Pull Up with Limbs and Things. Tonight, we're talking to Miss Octavia Ellison, who is a recreational therapist. And we want to just give you a little information about recreational therapy as a whole. There's so many things that people just don't know. So, have you stopped doing something that you actually really love to do and you wish, man, I wish I could get back to doing it? Well, a recreational therapist can help you do that. So, Miss Ellison is a recreational therapist that I met when I was at Warm Springs doing my clinical internship there. And I have since followed her, I guess, back to ASU. And she gave me my first opportunity to be a guest lecturer in the recreational therapy department. So, welcome, Miss Ellison, to Pull Up with Limbs and Things. How are you?
I'm doing well. Thank you for having me.
Yeah, sure. So, tell us a little bit about how you got started as a recreational therapist.
Okay, so no one knows about recreation therapists unless someone tells them about recreation therapy.
So
So
true.
I attended Alabama State University, and while there, I'm thinking like, okay, well, I want to do something to where I can help people because I like working with people. I enjoy it. My mom says I don't meet strangers. So, of course, PT was at a doctorate level, so couldn't do that. And so I was like, well, maybe I can do OT. That may be interesting. Well, time I finished up my core classes, they were turning the occupation therapy program into a master's level program. So I was like, I need
Mm.
that. And so I was like, well, what am I going to do? I really want to help people. So then I looked into psychology and found out, well, you got to have a master's if you're going to practice. And I was like, I don't even know if I want to go back to school to get a master's. So that is not what I'm going to do. And then I
Yeah.
had a good friend, Shamika Stinson. She asked me, she said, have you heard about the recreation therapy program? I was like, no, what is that? And so I was like, you know what? I'm just going to take one class and then I'll see if I like it. And I took
Yeah.
one class, and that was Foundations to Recreation Therapy. And I fell in love. I was like, oh my God.
With foundations. Okay.
And that's like one of the hardest classes, but just
Right.
foundational knowledge about this is rec therapy and this is what you can do with rec therapy. I was like, I can see myself doing this. This would be fun, and I get to help people at the same time and have fun. This is like a fun job. And so
Right.
that's how
So
it
with
all
you
started.
saying that, how would you describe rec therapy?
Well, with rec therapy, I would say as a recreation therapist, you are the person that provides recreation experiences that are conducive for resources to help people to sustain their well-being through a therapeutic way. Even though it's fun, it still has therapeutic components to it because we look at the person as a whole. We look at their social areas, cognitive areas, the physical areas, psychological, spirituality, and leisure and well-being. So we take care of the person as a whole. It's not just looking at one aspect.
That's so true. Who would you say needs recreational therapy though?
Who needs it? Well, typically we work with people that have a disability, some type of disability, illness, or injury. But I personally feel that all people could benefit from having a recreation therapist because even if you don't have a disability, illness, or injury, you could use recreation therapy as a way to work on not having an injury, not things like that. So you can use it as like a precursor. Like, well, I'm going to do these activities so I don't have issues later on in life.
Right. Okay. That's true. So if you're watching with us and you have a question about recreational therapy or physical therapy and how the two interact, you can put a comment or question in the chat and we'll answer them. So I have another question for you.
Okay.
What benefits do you think recreational therapy has from the standpoint of all the areas that you just mentioned? What are some benefits you've seen with people that you've worked with?
Okay. Well, so I work part time at a hospital here in Gainesville, Florida. I work at UF Rehab Hospital. And what I'm currently doing with my patients there is I've implemented a chair Zumba program there. And the patients that we see, they've had strokes, they've had transplants. Some of them have had motor vehicle accidents, just a variety. And they are of the aging population. Most of our patients that we see there are 65 and up. Sometimes we
Mm-hmm.
do some that are a little bit younger, but most of them are 65 and up. And so, like I said, I implemented a chair Zumba program. And that's because if they aren't actually able to stand up or they're working on their standing endurance, we can still get that same physical activity, but we're getting it from a seated position instead of actually standing up. Now, I do co-treatments with the physical therapist there. And so when we're ready to start working on that standing endurance, that balancing coordination, then that is when we go into co-treatment mode. And then they're actually standing up doing that. And I've had some patients like, well, I used to dance, but how can I dance in a wheelchair? And that's when you say, well, you don't have to actually stand up to dance, because I promise you, you're going to get the same workout, whether it's standing up or sitting down. I'm sitting down in the chair while they're doing it, and I'm sweating as if I was actually standing up and moving around. So just to keep them, physically active.
Right, I agree. There's so many benefits, and we kind of don't always think of the ways that we can continue to do something fun when we don't do it the same way we used to do it. So I'm glad you mentioned that. So here's a question: what if I'm disabled and not able to walk? How am I still able to play pool, like billiards?
Play pool. Okay. Well, they have all kind of adaptive equipments and stuff. So even though you're in your wheelchair, whatever, it's all about like positioning yourself in the right area to where you can still play pool. And like I said, as your recreation therapist, if there's something that you feel like you can't do, I'm the one to provide you with the resource and say, hey, we have this type of adaptive equipment, so you can utilize this if you're wanting to play pool or any other activities that you're trying to engage in. We are, as recreation therapists, we are your resources, because a lot of times people don't know unless you give them the information. They just think because, oh, I'm disabled, I can't do these things. But there are a lot of adaptive sports out there in general that people are still just now finding out about. So as your therapist, we will find different type of adaptive equipment for you to use.
Right. So I remember at Warm Springs, there used to be people who just had a visual deficit where they weren't able to see small writing. So they still wanted to play cards, but they couldn't see those numbers. So can you tell us a way that recreational therapy can help someone to still play cards, even though their sight has changed?
Okay, well, they have the cards where the numbers are enlarged, so you have the larger the larger deck of cards. But something that I just recently found, I know you're saying they just have a visual impairment. They got Uno for Braille people.
That's great.
So even if the person is completely blind, there are resources out there for them to continue to still be able to have that social interaction with people. And that's another part of the domain that we look at, is social interaction, because we need that as people to engage with other people and not to just be isolated all the time. So yes, there are adaptive ways, like I said, enlarged cards, cards with Braille imprints on them for people to utilize.
That's true. Okay, there's a question about, what do your credentials mean?
Okay. So I am a CRC, which is a certified rehab counselor. And I'm also a CTRS, which is a certified therapeutic recreation specialist. Um, now, as a certified therapeutic recreation specialist, I can provide activities that are therapeutic, because let's go here for a minute. Let's make a difference, because somebody may have heard of just somebody that's an
Activity therapist.
yeah, versus someone that's a recreation therapist. In order for me to have these credentials that I have, I had to go to school and earn a 4-year degree, and then I had to sit for a national certification exam. And once you sit for the certification exam and get your credentials, then you can practice therapeutic recreation. And the difference is, when I just talked about those domains with you, where you're working on social, cognitive, emotional things like that, it makes it therapeutic versus it just being some type of activity that you're participating in, because we now know how to write goals and objectives. So we're looking for a specific outcome to come from the treatment that we're doing. We're not just doing an activity just so somebody can be doing something. We're doing something because we're looking for change, whether it's to improve something, to decrease something, things like that. So it's a therapeutic aspect.
Right. And so that's why when I was in school, I wanted to find a major that kind of coincided with physical therapy. And so I became a recreational therapist and actually sat for that same exam you just mentioned. And I do have my CTRS as well. But it is so important to me that I bring an element of fun into recreational therapy, but also with a goal in mind.
Yes.
And so I wanted to make sure that, that was conveyed in our discussion today, that the two can work well together, especially for people who think that they can't go back to doing something that they used to do.
Oh yeah, definitely.
So here's another question. What type of activity would you recommend that a person with two fractured toes do if they are working to heal?
Two fractured toes. So that means they're probably not wanting them to put weight on those toes. And then that's where we would go into some chair exercises. I mentioned to you guys that I do chair Zumba, but then there's also chair yoga, especially if they're trying to be physically active. Now, it also depends on what that person likes to do because remember, we're recreational therapists, and I don't know if I mentioned this. One of the key things that I think is different between the other therapies versus recreational therapies, when I say other, like physical therapy, occupational therapy, is because we give our patients a choice. They get to actually choose like what they want to do as far as
Yeah.
lead goes. We don't just make them participate in an activity that they don't want to do. Although OT and PT now that's therapeutic and it's to help them to heal. But in recreation therapy, I think that's the main difference is that we give the person a choice in whatever it is that they like to do as far as their leisure is concerned. So that would also, again, that would depend on what that person's interests are. And then also because of the toes being fractured, we know we're probably not want to. It's probably like a non-weight bearing thing with that since they're fractured. But I would just to say, without knowing the interest, that we would do some chair exercises.
Yeah, true. Or anything that's I guess more along the lines of what they would want to do, even if it's sitting. Like, and you can speak to the fact of incorporating other elements like the social aspect or the psychological aspect. Oh my goodness, you have fractured your toes. You can
Oh yeah.
still, get past that.
Oh yeah. And for recreation therapy, I think it does a lot for like the psychological aspect of it because that means something has changed and they may feel like, well, this is happening to me now. I'm not able to do this. And if it's something maybe a little bit more major than they fractured their toes or whatever, some people, they get depressed because I'm not actually able to engage in the same activities that I used to do, or they think they're not able to actually engage in those activities until they
Yeah.
get with a professional they can provide them with resources and tell them the adaptive equipments um, that they need to utilize in order to be able to complete that task.
True. Okay. How do you incorporate families and loved ones into your sessions?
Um, if families are there and they want to be involved, actually, I can give you an example of how I incorporate family now. If the family member has someone that they're caring for and they have an injury and they have an illness, the family members are stressed too. They need an outlet as well. And so another program that I implemented at UF Rehab Hospital is the meditation program. And so when the family members are in the room, they always say, well, can I stay? And I'm like, sure, this is for you too. So
Mm-hmm.
I incorporate meditation with the family members as well as the patients. And I think sometimes the patient's family enjoys it more than they do. And they're like, well, what time will you be back to do this? Because we can't come into because it's a certain time that they can come. So they want to know, well,
Right.
will you be doing this in the afternoon because they want to be there so they can engage in the meditation as well.
Mm-hmm.
Even with prior to pre-COVID, the patients' family members were allowed to come to their sessions with them. So when I was doing Zumba, if we were playing cards, whatever it was, I welcome the family members to engage in that because we're looking at things, especially if it's whether it's something new or something that they've always been doing. These are transitional behaviors. So when they go back home with the family, these are things that they can do with their families. It's not just something that I'm doing here at the hospital. I can also do this when I return home.
Right. True. Here's another one. What aspects of therapeutic recreation do you least enjoy?
Um, I will say just the lack of people not knowing what recreation therapy is because they don't know what it is.
Or all you do is play.
Yeah, all we do is play, or they just assume, well, where are you guys planning a party for this holiday? It's like, wait a minute. Wait a minute, that's not all I do. Or are you guys gonna decorate the board? So just people not knowing exactly what you can bring to the table and how you being there is beneficial to the patients. And so I think that's the thing that I least enjoy about it, is just people not being aware of how beneficial this therapy is.
Right. So that's why we're coming to you today. We'll pull up with LimbsNThings with a recreational therapist, because that is the therapy that you don't see a lot in different sections or settings, but
Yeah.
it can be the most beneficial because it does probably more of a holistic approach than with speech, with
Mhm.
OT, or with PT, just the areas that you address. So here's another question. Do recreational therapists work closely with other health professionals?
Yes, we do. We have what we call co-treatments. So it depends on what that patient is needing to work on. Would be that would be the other discipline that we would work with. Earlier, I mentioned that I did chair Zumba with the physical therapist, and that's because the physical therapist is trying to observe that person, that patient's endurance, their balance, and their coordination. And so that is when I would engage into a co-treatment. Also with games. This is something that I've been doing since I've been at the hospital.
Mhm.
Board games like Yahtzee. And so I co-treated with the physical therapist, and what we did was the patients had to get up from their wheelchairs, walk over to the table, take the cube with the with the dice in, and then shake it up, and then roll it out, and then they actually walk back to their chair. So it was just like, okay, we're gonna work on your walking and your balance, but the board game was incorporated with that activity. So you just have to. One thing that I would say that I like about recreation therapists is that we get to be creative. Like you
Yeah.
get to put a spin on the activities that you were doing. You get to co-treat with OT as well. I played some different card games with OT. Even worked on iPads with the occupational therapist, and so different things like activity or daily living stuff, helping the patient to know how to utilize the iPad. Like, what are we searching for? What are we looking for? We need to order some clothes for you, and different things like that. So it just depends on what the patient is working on. That would depend on which therapist I will work with, whether that be PT or OT. I haven't had a chance to work with the speech therapist yet, but um, if they needed me to co-treat with them, I would love to do that.
Yeah. I can see speech being a good co-treatment session with you too. Okay. Does insurance pay for recreational therapy?
We are not, at the current hospital that I work at. We are not a billable service, so no, insurance is not covering that. It's just the hospital decided that they value recreation therapists, so that is just something that's optional for the patients that are there. I have yet to talk with anyone to where recreation therapy was a billable service. I think that is something that we as a profession need to work on. If we just continue to share how it is beneficial to the clients, and just more research and get more writings out about recreation therapy, I don't see why it couldn't be a billable service one day.
Yeah. Now, I was a recreational therapist, a travel recreational therapist in California, and it was billable there. I think it depends on which state you work
Okay.
in terms of having all the coverage that a person would need for rec therapy services.
Mhm.
Let's see. What can you tell someone who is seeking a recreational therapist? How would they get in touch with one to provide services to?
Um, Google. I would say Google, and the reason I say this is because there is this website, and it leaves me. Now I'm sorry. I will probably give it to you and you can share later. But people
Okay.
looking to practice in rec therapy, like looking to start their own business, there is this website that you can go on and put all your information in and your credentials and things like that, and it just has your information up there. So when they go, it may be called my recreation therapist.com. Don't
Okay.
quote me on that. I will look it up so that I can share it with you guys. But then they can go on there and find recreation therapists in their areas, like whatever state you're in. You can put that in, and it'll show you like here are the recreation therapists in your area.
Yeah. Now, is there anything specific to the aging adult population or conditions that you see in this population that you think recreational therapy is most beneficial for?
Yes, physical activity as well as socialization,
Hmm.
because the older you get, there it's the older you get, there may have been a lot of losses that the patients have had, and so they don't have as many people that are around their age or in their neighborhood. So just to be able to go out and engage with other people and meet new people, that helps them with the socialization, decreases the isolation and the depression, because they're actually engaging in something fun, something that they like to do. And then the physical activity, because we gotta, our bodies were made to move. We can't just live a sedentary lifestyle. I don't care what age you are, you need to be mobile. You need
Yeah.
to move. You need to always be working on your range of motion, strengthening your muscles and things like that. Because if you don't use them, you lose them. And so that's a good part of it. I walk, and this is like outside of work here in Gainesville, Florida. There's a group of older ladies that I walk with. They walk Monday, Wednesdays, and Fridays every week. I don't care what the weather is like. It could be raining. Those ladies are out there.
That's
And
great.
Buzz was like, "So you're over there walking with a bunch of older ladies?" And I said, "Hey, let me tell you something about these older ladies. I can depend on them.
Hmm.
Somebody is over there every day." And the lady that started the group, I think she said they've been doing this for about 15, 20 years, just
Wow.
walking. And so
Hmm.
that gives them a time to come over there and they have their social interaction while at the same time getting that physical activity. And so I think that's really good for the Asian population, is to just stay active and just to be around people.
Yeah. Is there any, I guess, pandemic times type of activity that you think is most beneficial or that you suggested that people do if they are still not too sure if they should leave their home or not to engage with other people?
Okay. Well, this walking group, we all have our masks on, even though we're outside. If everybody has been vaccinated, but we are all still wearing our masks. So, I would encourage that you take all the safety precautions that you can, whether that be you wearing your mask when you engage in these activities, because some of these activities are taking place outside, whether it's a walking group or whether it's a dance group. They're even taking all of these things outside.
Hmm.
If you are inside or whatever, because a lot of old people, not all older people, but a lot of older people like
Right.
bingo. They like playing bingo. Well, you don't have to be at the same table to play bingo.
Mhm.
So just making sure that there are spaces between everybody that's engaging in those activities. um because again, I'm big on not like isolating ourselves, making sure that we are around people. I know at one point we had to, like, okay, you can only be with the people that you live with, but again, just
Right.
make sure that you're taking all of the necessary safety precautions, wearing your mask, sanitizing your hands and things like that, because that's what we're doing. Like with our cards and stuff, we've even laminated our cards. And so after each our playing deck cards, after each section,
Yeah.
we wipe the cards off so
Hmm.
that when they're ready for the next set of people to use them. If it's certain things that just sanitizing things after you utilize them.
Yeah. That's good. Okay, we're gonna switch to your other hat, which is teaching. So that if anyone is interested in going into recreational therapy, you can know about what Octavia does.
Okay. All right. So I teach at Alabama State University. I have been teaching there. At the end of this semester will be 9 years. I teach recreation therapy courses there. Um, let's see. What what do you want to know specifically about that? Like the type
So
of.
it's an undergraduate degree that you can get in recreational therapy, right?
Yes, it is an undergraduate degree.
Yep. And there are very few programs at HBCUs, I believe, right?
Yes, it is. That's unfortunate, and I really think that's because a lot of people again don't know the benefits of it. We got to
Right.
really push the benefits of it. But yes, the program requires that you take general rec therapy courses. Is about two general rec therapy courses, and then you have core rec therapy courses, and you just learn about different things. We talk about the foundation of rec therapy. We talk about the different techniques. We talk about different diagnoses in the field of rec therapy, because if you're gonna work, a lot of times people think, oh, well, you're just playing. It's like, no, we actually had to learn about diagnosis and understand the diagnosis, because you can hurt somebody playing. If
Right.
you're not familiar with the diagnosis that they have, you should be. You should be.
Mm-hmm.
That's what makes us different from just an activity therapist. A
Right.
recreation therapist and an activity therapist is totally different, because they've gotten educated about it. And then again, like I said, we have clinical experience as well. They get two clinicals. They have a part one and a part two, and then they also have to do an internship where they complete up to 600 hours. And
Right.
so there's a lot of hands-on practice within this major, and that's great because a lot of times when people are graduating from a program, sometimes people say, "Well, you don't have any experience." Well, that's not the case for the recreation therapy students, because they've gotten all this clinical experience and they're ready to go. They've gotten all this hands-on experience.
Right. And I will always vouch for recreational therapy as being a great segue into going into physical therapy. But I did take the time to work in it because I thought that it was a great field, and it kind of was a lot of similarities between physical therapy and recreational therapy. But PT was my ultimate goal. But if it wasn't, I would have still been a recreational therapist.
Oh,
But I thank you so much for your
that
time. Go
Oh,
ahead.
you're welcome. I was gonna say, that I always utilize you, and I'll share your information with students that are saying, "Well, my ultimate goal is to be a physical therapist." And I was like, "Oh, okay, I have this person right here that I need you to speak to about this," because that is a lot of our students do use it as a segue. Whether some of them are saying, "Well, I want to be an occupational therapist," or I want to be. I think had a few that said they wanted to do athletic training. So
Yeah.
sometimes it is like it's just a segue for them to get to their next level. But again, I think it's a great segue because, like I said, you get that hands-on experience.
Right. And that's what you don't see in a lot of the science fields, though therapy, specifically physical therapy, is really high on physics. Having the clinical aspect helps you to deal with people, because that's ultimately what you have to do once you get out. You deal with all these different personalities, and you have to
Mhm.
know how to address the person from every aspect of who they are.
Oh yeah, definitely, definitely.
Mhm. So, do you want to give us a final thought?
Um, yeah, sure. For those of you that are watching, I hope that you did take something away from it. If you know somebody that's um, looking for a profession, getting ready to go off to college, because it's around that time of the year where we got people graduating and get ready to go to school. Please share this
Mhm.
video with them so they'll learn a little bit more about recreation therapy, and see if it's offered at the university that they've decided to attend.
Right.
Also, um, uh, check out ASU's program again, because we have it there at Alabama State University, but there are other colleges that have it as well. So please just share, share, share. This is a fun major, but it's also a science-based major. So that's
Yeah.
the component that makes it therapeutic. So you do get to have fun, but at the same time, you get to help with somebody's overall well-being.
True. Oh, I have one more thing.
Okay.
Settings that you can see a recreational therapist. And you said you work in an acute setting, like a hospital, but you're
Mhm.
also working in the educational level. Where else can you find a recreational therapist?
Oh, just about any way you can think of. Recreation therapists can work in a school setting, and that is if the school offers recreation therapy positions there, they can work there. You can also work in a prison setting. You can work in a psychiatric hospital, a VA hospital, rehab hospital, community settings. There's just a lots of places you can work, and you can work with all ages. Let's throw that in there too. You can work from newborns all the way up to our senior age population. So it's a wide net of things that you can do with this major. So you just get to kind of explore yourself. If you know you like working with kids, then hey, there's an opportunity for you. If you like working with our seniors, there's an opportunity for you. You want to work with our veterans, that's an opportunity for you. It's just so many opportunities in the field of recreation therapy.
Yeah. I think there is a question I'm missing, and I'm trying to find it. Let's see. I'm not seeing it, but I don't want to miss anybody's question. So if you have a question and I missed it, hold on 1 minute. I'm looking. Anything else you want to share, Octavia, while I'm trying to find it?
Um, let's see
No, it's cool.
what can I share with you guys while we're looking for that? We kind of talked about where you can work and who. Pay. Let's talk about pay because I think a lot of times when people are looking for a profession to go into, they want to know what does the money look like.
That's a good one.
That's a question I get a lot from my students, and well, we talked about the credentials, sitting for the national certification exam. Once you get certified, that is when you take your earning potential up so much higher. Depending on the setting you work into, that will play a part in the type of money you will bring home. Community settings typically tend to pay around the lower range area. They're probably independent on the state where you're in, but we'll probably say like if you're in the Alabama, Georgia area, community facilities are usually in the 30,000 range area, like 35, maybe 36. You get your certification and you get a job with the federal government. You are looking at anywhere from 64 to 84,000 a year, and that is in Alabama and Georgia. Again, depending on where you are, that will determine the amount of money you can make in the field. But it can be very lucrative to you, just depending on the site, the facility that you are at, and also if you are in a supervisor's position, because I've seen some therapy supervisor positions at the VA that are in the six figures. So you can make money in rec therapy.
You can, and you can see a lot of different settings by being a travel rec therapist. And there are other perks that come with being a travel therapist, from housing stipends to being able to have like bonuses that come to you after you complete a stay of working somewhere. And then what else is there? Just the bonus of being able to be in a new setting every so often, right? So I did find the question. Oh, and then as travel therapists, you do get, it's pretty lucrative.
I'm still getting some of the emails because I get emails, and I think the last email I got, it was like $1,200 to $1,400 a week, and like you said, with additional stipends to go along with it.
And weekly pay is always a bonus.
Oh, yeah, definitely.
All right, I found that question. It says, what are some of the tricks that you use to get your patients excited to get involved?
You know what? I really don't have to use tricks because let me tell you, and these are some of the things that patients have said. And this was just this week. One of my patients said, "You are the only therapist that I look forward to coming to my room." And that's because we are the people, when they see us coming, we are the people that's coming with the fun stuff. It's like, no, she's not coming in here. She's not going to make me do something that's going to hurt me, or she's not going to make me do this, or he's not going to make me do this. So I don't really have to use tricks. Now, let me say, I will say this because I have worked in another setting prior to this setting. When I worked in Warm Springs, one of the tricks that we used to get the students to come over. Now, this was a population of, I would say, 18 to 21 was usually the age range there. We got them with food. If you feed them, they will come. So
that might be anybody, Octavia.
well, it worked for them. Like if they knew that, oh, we're gonna have some food over here, they would come and participate in the activities. Like, and it was usually the open activities. Like we gotta have some food because if there's no food, they're not gonna come.
Mm-hmm. That's true.
That would be the trick. But most of the time, like this, like I said, this setting now, I don't. If they're interested in it, I don't really have to trick them. They just know that because, like I said, they're gonna get to do what they want to do.
That's true.
When
and I use that. I ask people all the time. I said, "So what is something that you haven't been able to do that you want to do?" And some people will say, "I used to play cards, but I don't play it anymore," or "I used to bowl, and I don't bowl." So when I'm doing balance activities, we're bowling, or we're doing something that is fun for them to do. Even people who say, I haven't been dancing, and I wanted to dance again. Right. So some of our activities on balance or standing and endurance will be a dance move. So those are ways that I incorporate recreational therapy, and I guess those are tricks that I use.
Oh yeah. see, you see how you have to go and dig back on your recreational therapy.
I use it every day. Yeah. Okay, so I have another question for you. What's next for you?
What's next for me? Like I said, I've been teaching for 9 years, and I just recently got back in the field part-time, but eventually one day I will see myself getting back in the field full-time. I mean, I love being a clinician. And I like being an educator as well because it's been great to see the many students who graduate and to be out there working in the field and just making changes in people's lives that they are serving. So that has just been a blessing to be able to see that. But again, and Dr. Neely had told me that she said, "Miss Ellison, you are a clinician at heart." And so probably just returning to the field full time one day is one of my goals that I have.
Well, that's great. I think you made a great impact at ASU, and they're going to be sad to see you go. All right, there's another question. What states offer big for recreational therapy? Is that for me, Shamika? It is California. West Coast tends to be very accepting of recreational therapy as a profession that's widely accepted. We tend to not be so much on the East Coast, but with travel therapy, you can go all over. But I found the most lucrative to be in California. And then, what are your favorite interventions? Is another question. I think that might be the last one.
That might be okay. Aquatic therapy.
I remember when you did that in Warm Springs. Yeah.
Yeah, I like aquatic therapy, and I guess I would say any type of physical activity that I can do with the client, and arts and crafts. When I worked in Warm Springs, I would do ceramics with the students. So
I remember that.
Yeah, so those are my top 3: aquatic therapy, arts and crafts, and physical activity.
Great. I like it. All right. Oh, you thought Colorado? That's true because that's over west. And then some of the northern states too. Yeah, I can see those being the same, Shamika. So is there anybody else that wants to ask a question? I don't want to miss anybody, and I'm trying to catch them all. But I thank y'all so much for joining us for Pull Up with LimbsNThings and finding out more information about recreational therapy from Miss Octavia Ellison. Is there anything else, everybody? That's everything? All right, we thank y'all so much for joining us. We hope you come back, see what's up for next week. As always, Pull Up with LimbsNThings is to help you learn something you didn't know, confirm some things that you do know, and to hopefully share that information with somebody else. Have a great evening. Bye. Take care, Octavia.
Bye.